Hey, ideators and entrepreneurs, CUNY Startups here. Welcome to CUNY and Beyond, the podcast dedicated to helping aspiring entrepreneurs through storytelling. We're excited to dive into the entrepreneurial endeavors of CUNY students, alum, and bonus entrepreneurs who are willing to share their valuable insights with you. Join us for today's show.
Hello, everyone, and welcome to CUNY and Beyond. I'm your host today, Gail Yankosik, and I'm delighted to have a young woman who I had the pleasure of working with several years ago, Lauren Elliott. And she is the founder and chief executive officer of Candlelit Care. Lauren, it's so good to see you again, and so good to see your progress since we first met. So tell us a little bit, if you would, about why you started and what was the impetus behind you starting Candlelit Care.
Thank you so much for having me. Yes, so Candlelit Care is it's a conduit between parents who are experiencing mental health disorders or just symptoms of depression, anxiety, even PTSD, really in that anywhere in the perinatal period. So really thinking about trying to have children, currently pregnant, and also a new parent. So in that postpartum period, right after they've given birth. And we really want to make sure that they have access to mental health support that is reflective of them and doesn't come with as many barriers and blockers to actually receiving the benefit of what that therapeutic approach can look like. It's making that more accessible, definitely affordable, because we don't present any costs or any financial burdens to the parents themselves. We're really going after the institutions that are supporting them and serving them and also, helping them to deliver and give birth. And really how I got to the space and even created the company was at the time when I was pregnant with my oldest, I was working in public health. And I was really exposed to a lot of information, some not so positive. You're thinking about maternal mortality rates, definitely knowing in a very real way that Black women were at the time in New York City 12 times more likely to die during childbirth. So just very stark and sad statistics. I was just really exposed to them and really knowing the problem in a real way. Once I became pregnant, it was really feeling the experience of a patient in that moment, experiencing pregnancy for the first time, but also experiencing what really engagement with doctors and OBGYN looks like, how many appointments I receive, and just the education about like what to expect as a pregnant person going through this journey. I think there's a lot of talk and discussion about like planning for baby showers, and there's a lot of glorification of the external facing kind of moments of pregnancy, but as an individual, there's a lot going on in your head. There's a lot of anxiety that no one really talks about. And you also have a lot of these instances where either you may be going through anxiety-ridden experiences, right? Like you may be thinking about, okay, what do I need to prepare for this prenatal visit even, let alone how do I prepare the nursery? So really, at the time, I did not feel supported from a provider's perspective in really knowing what to expect, let alone knowing the sort of anxieties and stressors that could be lying just kind of dormant. Once I was around like 38 weeks, that's when stress levels just kind of skyrocketed. We learned that our son was in distress while I was still pregnant. So we were educated about what was happening, what was going on. It was the first time we had known that was even possible, of like the manner that he was in distress. It wasn't as if he was breached or anything that like normally is just kind of widespread information when you're thinking about pregnancy and even like childbirth related complications. Because of the level of distress he was currently in at 38 weeks, I had to get admitted into the hospital. And then there was a situation where it was like we were told by a doctor that we would be essentially giving birth today, like the same day that we learned about the distress, the hospital that we had already planned on giving birth in, but nonetheless, right? But yeah, so working in public health, I remember how much emphasis we placed on and investment went into prevention. So in the moment we had to get admitted into the hospital, it was just very stressful, a stressful moment for us. Then had to get into a situation where we had to sort of advocate that we wouldn't be leaving the hospital. It was the first time that I had learned and talked a lot about advocacy, patient advocacy, but it was the first time in my life that I had actually had to experience being an advocate for myself. So I didn't learn about really therapy until about 2 years later. And it was a coworker who opened my eyes to it. This was before the pandemic. And she was like, yeah, I have a therapist. They're great. She's a Black woman. She's been very helpful to me in very stressful moments of my life. And I was like, oh, okay. let me see if let me try this therapy thing out. Tried it out. I ended up staying with that therapist for 2 years, and I told her, I was like, "Where were you 2 years ago when I was when I was postpartum?"
Yeah.
And that's when I really got the idea for Candlelit Care, because I was thinking, well, parents in general should not have to wait 2 years, let alone 2 minutes, before they get connected to this form of mental health support and emotional well-being support in a way that feels reflective of what they're actually going through from someone who has lived experiences
Right.
and someone who can actually help. So that was the impetus for definitely creating Candlelit Care, especially for parents who are just like me, who are in these environments where not only are they experiencing the stressors of pregnancy and postpartum and even like fertility journeys, but even the barriers when you're even thinking like, hey, now, especially post-pandemic, I'm in a space where I am willing to enter therapy, right? It's not as stigmatized now.
Yeah.
But how do I navigate? How do I navigate finding a therapist that I can afford, frankly, that's, licensed in my state? Like, there are all these barriers that are in place, and the stakes definitely get higher for women of color, people of color in general, especially in the stage of life, women of color. There's a struggle definitely to find that support. So Candlelit Care really breaks down those barriers across stigma, across cost, and really works directly with the providers. So those hospitals, those health systems that you're giving birth in, we directly partner with them. If you're giving birth at home, we directly partner with doulas and midwives so that there's no barrier that's in between really receiving mental health support that's not necessarily directly appointments with direct therapists.
Mm-hmm.
We have coaching. We have perinatal mental health coaching. We have mental health psychoeducation in the form of like this weekly program, as well as we also have the capacity to screen and really help right size what the treatment and the like sort of support level needs to be, so that for example, if you're in your prenatal visit and you get screened using like a standardized tool, you may be given those screeners or those questionnaires. You may not be familiar or told what they are, but you may hear like, have you been feeling hopeless lately? That may click or be familiar to you when you're postpartum specifically, of course. So we have those scales, but let's say you do need support. Really, there's a break in linkage to care right there, right? Usually it's like maybe the OB/GYN doesn't have a Rolodex of therapists or even just mental health support professionals who you can be sent to, who you can be referred to like right away. We are really positioning ourselves to be that direct referral source for those providers so that the patient and the parent does not experience
They don't have
a
that
break.
stress and that anxiety. You are a success story, but it came with a lot of hard work. And for folks who are watching us, for young entrepreneurs who are listening to this and looking at this, let me take you back a few years. We met through the CUNY School of Public Health, which was a mentorship program. So based on that, when you were starting out, what do you think was the hardest thing you had to overcome? And what is your best advice for young entrepreneurs or startups who are frustrated and stressed right now? And I know that your journey wasn't easy. I understand that because we've talked about it.
I would definitely advise young entrepreneurs, especially if you are not particularly in healthcare, to really find a problem that you want to solve that you are connected to personally. It, for me, has helped me go on. It's helped me overcome the sort of peaks and valleys of this journey, because it's definitely a journey. A lot of people do compare it to giving birth, but it does become like a life mission for sure if you are dedicated to it in that way. So I definitely would advise to like just sit with yourself and really determine what you are really passionate about, what problem you're very passionate about solving, for one. If you are a healthcare founder, I would definitely recommend programs and accelerators like the CUNY Public Health Accelerator with Firefly. I am a huge proponent of the accelerator, and I really, my time in the accelerator was an inflection point for sure. Mm-hmm. I think having that level of support and mentorship, specifically from folks who know the healthcare industry and who at least can approach the healthcare industry from these different perspectives and lens, like academia, very, very valuable insight was shared during my time in the accelerator. And there are not enough accelerators in general that are focused on public health, let alone healthcare in general. I would say what's been the sort of hardest thing for me to really overcome. Talk to as many people as you can to really make sure that you're solving the right problem for the right person. So what's been very hard, but also very beneficial, is having to really navigate healthcare as a space for that is, while it's ripe for change, especially from a social impact and systems level change. Like, our mission is for systems level change, and that's a real reason why we don't charge parents for our service offering. My time in the accelerator really helped me right size which problem I'm solving for what entity and what person. And that work is very beneficial. It's very valuable. It's very crucial to your early entrepreneurship, because you're talking to lots of people, and you may feel like you're being sort of kind of swayed in different directions, but it really helps you, put you in a position to, what do I allocate my energy to? I've definitely gotten involved to certain entities, and I have pursued that. But then the minute that I learned, okay, that's not going to be the best pathway for me and for the company, I've reallocated energy. Don't stay on something that may not be working for you for a long period of time. Learn from it, move on, and stay nimble, for sure. And those are things that I've had to do.
Excellent advice, because in working with young entrepreneurs for several years, they just have a hard time sometimes giving up that dream, that first dream. They need to know, and you try to, and this is great advice, because you try to say it can evolve, it can change. And I've worked with groups that have changed midstream because they said, this isn't working, exactly what you're saying. So I think that's wonderful, wonderful advice. You take the mother prior to birth and don't give them up at birth, correct? You work with them past that. So that's a unique part of what you do. So just tell me why you feel that's so important.
Thank you so much, Gail, for that question, because that is exactly what a lot of, I think, the perception is, and how it feels, at least for even Black pregnant women, is that their care just stops. But yes, we were very intentional about not mirroring the exact sort of journey of care. A lot of questions we usually get is like, how do you, what's the patient journey look like with you all? Well, it's very supplemental and it works adjacent, but instead of, it dropping off at that 6-week mark for at least postpartum care, we that's where we get into full gear. I feel like in a lot of ways, we are definitely preventative. So we are trying to prevent, we're a preventative solution that's trying to prevent depression, anxiety, anything that falls within the perinatal mood and anxiety disorder realm from happening in general, right at the onset. Let's say we are referred a mom at 6 weeks or 8 weeks postpartum. I think that's when we're really beneficial, because that one, from a public health perspective, that's where a third, in those first 45 days is where a third of the mortality rate, the actual deaths happen, may occur in those first 45 days. We've known that through clinical research. And that is also when you now have a human being who you now have to support, especially if it's your first child. So you just need so much support. You may not know how to ask for help. You may not have been even taught, or even like given the space to ask for help, to know what help you may need. From a cultural perspective, there are different cultures that pretty much support pregnant people differently than other cultures.
Right.
And we felt like to be able to accommodate all cultures, especially within the African diaspora or Black identifying cultures, we want to be able to work beyond postpartum, so at least like up to a year postpartum. And through our content, yes, we have about like 8 to 12 weeks worth of content, but we have our coaches who also sort of supplement that education. But for a lot of parents, for 80% of, like they say, the 80% of the parents that may be experiencing baby blues, we're here to really unpack what baby blues mean. You may have heard that before you got discharged from the hospital, but really you may not know what that means or when to expect it. We're really good accommodated for postpartum care, as well as those when you're going to those pediatrician visits. Really helping you in sort of in support and in partnership at that stage with your pediatrician, because pediatricians have the ability to screen parents as well for depression or anxiety. Not a lot of parents know that, but a lot of pediatricians are very willing to do that.
You know that, so you can help them.
Yes, absolutely.
Thank you for the work you're doing, but thank you also for the good advice you've given, not just for moms in this, but stepping outside that role to give some good concrete tips for young entrepreneurs in almost whatever stage they're in, so that they have a sense of how you got to this point. Good luck to you. I'll keep looking for Candlelit Care.
Thank you so much. It's been a pleasure. Yes.
And enjoy that new little one.
Will do. Thank you, Gail.
Boy, I've got to